Hi guys, Ryan Keats, your local sports therapist here in Sussex. Today we are back onto the exercise series and we'll be using milk bottles from modified circuit session. They kind of mimic a kettlebell. It'll be more difficult to use two hands and you won't be able to increase the weight too much. I've used water, but you could use sand to make it a lot heavier, and of course less water if you want to make it lighter. You'll be able to make a great workout with them with the added element of stability. As the water splashes around, it will have to be done in a more controlled fashion. I challenge you to do this routine every day for 14 days. So I do not want you to feel sore tomorrow. I need you to want to do exercise. What matters more is longevity, consistency, and fun. Solidifying muscle, bone, and connective tissue alike. With that in mind, we'll get rid of the reps. All I ask you is that you move on to active rest when you start to feel out of breath. You should always be able to speak in short sentences without gasping for air. If you are used to low levels of activity, work through weeks 1 to 3 before trying these exercises. For the rest of you, let's do this. So your warm-up movements today are some jogs on the spot, just to slowly elevate your heart rate. Maybe some punch outs as well. Maybe some uppercuts. And some shakes. Make sure you're very loose, ready for these exercises today. If you have your milk bottle here as well, you can do some hopovers. Make sure you're nice and loose. These exercises, these movements that I've just done here also double up as your active rest. So whenever you pick something relatively heavy off the floor, I want you to remember this, okay? Hips back, so sit back, knees bent, chest high and proud, back straight, not vertical but straight. Pick up and squeeze the bum forward. So hips back, sit back, knees bent, chest high and proud, squeeze forward. Repeat that a few times. And that's our sumo deadlift. Sit down, back straight, feet crossed over, tap the milk bottle, tap down, into the middle, tap down, into the middle. Keeping your back straight, keeping your core contracted. And then go a little faster. And then go back into your active rest once you start to become out of breath. Once you're done with your active rest, your heart's calmed down a little bit, you're feeling good, you're feeling sharp, go down for a press up, okay? 3 options here. If you're not very comfortable with press ups, they're not the easiest things to do. I'm quite happy with you using your knees. Use a milk bottle on one side and up. If you're feeling a little bit more comfortable, then you can go into a normal press up. Lock the arms out as you come up, squeeze the chest in. Contract the core too so that the hip doesn't sink down. If you're feeling really brave, and then swap and do another 3. Okay, once you're finished with your active rest, you're going to go back down into a seated position. This one can be quite hard. You can actually move this down as well, but I'm going to do it the harder way. Okay, arms straight, contract the core, tap leg over, tap, tap, tap. Once again, only until you start to fall out of breath. Maybe around 20 seconds here. Go into active recovery. should be quite easy. Place it over the head, okay? All you're gonna do, contract the core, squeeze the butt cheeks in, and move the bottle around the head. It is possible you won't feel too out of breath from this exercise, so I would say only do this for 30 seconds before going into your active rest. Okay guys, after 3 sets of that, you should be feeling absolutely great, okay? You shouldn't be feeling too severely fatigued. If you are feeling any pain other than the comfortably uncomfortable exercise pain, then do not continue. Message me at @StRyanKeats on Instagram or sportstherapy@backblog.co.uk for advice on how to work out smarter. Stay positive, stay healthy, and stay safe.